So welcome everybody, and thank you for making the time today to meet with us about our upcoming implementation. Over the next roughly about 25 minutes or so, we'll just run through what's coming to your region and the EDIS system in particular. We'll just do a few introductions here, so I'll get started with that. The voice that you're hearing right now is Rebecca Ruche. I am the Organizational Change Management Specialist on this project, and I have with me today
Debbie McMahon. I'm the clinical lead as well as the EDIS coordinator with the WRJ Emergency Program. I've been dealing with EDIS since 2008.
Was everybody able to hear Debbie?
Yeah.
Okay, wonderful. And there's a few other people in the room as well if you want to.
Yep, I'm Amelia Sabrin. I'm the trainer for the ADT registration component of this application.
And finally?
Laura Thompson. I'm the Organizational Change Management Lead that will be looking after EDIS for Southwark Hospital, EDIS in Clydach.
Right. So I just wanted to let everybody know that we are making these sessions available to others who cannot attend today, and in doing so, we will be recording this session. So your questions, if you have any, will be heard on the internet for a short while after this. All right, so to get started, what is coming? So in November, Prairie Mountain Health will begin to introduce modules of our Provincial Electronic Patient Record, which is known as the EPR for short. The EPR is in acute care facilities across the province already, in many, where we've been rolling it out for several years now. And components are used in Northern, in Southern, in Interlake, and various sites here in Winnipeg. We are introducing the ADT EPR. This is the Admission Discharge Transfer component, and that was what Amelia was speaking about earlier. She is the main trainer on that. The Scheduling EPR, and the Emergency Department Information System, which Deb will demonstrate here today. The Emergency Department Information System is primarily used to track and monitor client activity and care in the hospital's ED. It offers a variety of functionality. So I know that in your region you have Brandon as well, and they're using the basic EDIS, what we call basic EDIS today. And that's electronic display boards and computer triage. In addition, we have lab reports, discharge instructions, and clinical documentation that will be coming to both your site and the clinical documents to Brandon as well. Today we'll focus on Dauphin, though, and everything that you're getting. The date for the Dauphin go live is November 18th, and the date for Brandon is the 21st. So I mentioned a little bit basic EDIS. So it's a triage note, and then there's also a reassessment flow sheet, and Deb will show you around to this in just a few minutes. There's a status board, which is a personal view of the patients in the emergency department, as well as the display board, which is a public-facing board. It is FIA compliant, but you will see patients who are in there, and I'll let Deb speak to that afterward. There are some discharge instructions, a wait time board that demonstrates patient wait times, as well as access to certain reporting tools to help understand what's happening in the department at any time. The clinical documentation portion of EDIS includes 12 documents. It'll cover everything from assessments, progress notes, charting of vital signs and other systems, consult request and consult reply, and some procedure notes. There's also another document that's the occupational therapy initial assessment specific for OT, and that's used across the province. There are some other features that come with this EDIS ClinDoc implementation that we'll be doing in Dauphin, including an auto fax of a visit summary to the primary care provider. So once the physician has completed something and it's marked as final, there will be a summary of the visit that's automatically faxed. In addition, there's some reports, and I'll just get Deb to speak to those really briefly at a high level here.
So some of the reports that will be there is including the emergency discharge instructions, so that if you create an appointment on the discharge summary note, you can actually print off this report that will identify the appointment date and time and who the physician is. The consult request report is that instead of printing off the request and to be faxed off to the family doctor, there's a new report that's going to be instituted by the time you guys go live that will have the demographic information as well as what the request for what the physician would like the consultant physician to see the patient. The other one is the consultant billing report. And the consultant billing report details all the consults the consultant has come and seen during in your department And this could be done retroactively, so that they don't have to print off that report every time they come and see a patient. They can come for a full week of call, then at the end of the week do and print it off. And they could be retroactive as well. So you remember 3 weeks later, think, oh, I forgot that, print off that sheet off. They can actually adjust the funds for that as well.
Right. Thank you. All right. So in thinking about the documents, about the tracking board, about the flow sheets, and about the reports, who is impacted by this upcoming EDIS implementation in Dauphin? We're thinking about physicians, all of yourselves in the room, PAs, nurse practitioners, nurses, unit clerks, healthcare aides. There are anybody who provides consultative care or support. So as Deb was just mentioning about the consultant billing report, we have our medical consultants. We also have our allied health folks who would be charting electronically in the ED, health records and patient registration staff. Hospital staff will see different documents in the ED, and so this is in the inpatient unit. They'll actually be getting the copy of the documents up there, and so they'll be seeing the new documents. So that's a lot of change to think about, but if we put a little bit of a box around it, if we think about examples of what's changing, all of the documentation, or most of the documentation, probably around 85% of what you would be charting normally will be electronic. You'll be assigning yourself to a patient, and you'll be using a tracking board to communicate certain patient concerns and plans within the department. However, not everything is changing. So some things that will be staying the same are how a consulting physician or allied person would be notified of a consult. So in saying that, there's no automatic communication between our system and where the consulting physician might be in their area. So if there was a fax or phone call today, there would be a fax or phone call tomorrow. Orders remain on paper, and then other documents such as the medical administration record, care maps and protocols, in and out, and blood transfusion record. Benefits, I'll just quickly sum these up, and then we can get into the meat of this where Deb will show us all the get us used to EDIS here. So it'll facilitate communication between healthcare professionals in the department, largely through the status board and through being able to read better in the documents. It'll provide central clinical documentation system, including a patient medical history, and this is shared across multiple sites. Again, the illegibility, you'll be able to read what everyone's writing, putting that one out there again. And of course, the auto-faxing. So this is an instant communication, which is of high benefit to keep the continuum of care once the patient has left the acute care facility to then be in the care of primary. And then just to give you an idea of training and support, your training will be just-in-time training, so as close to go live as possible. It's role-based, so you will be trained only the things that you need to know for your role, and it is in the classroom. But there is also an e-learning component, which will be taken in advance of classroom training. We will also be offering access to a practice database, so that if you learn something and you want to practice and reinforce your skills, you'll have the ability to do that. We'll send information on how to do that after training. And finally, support at the time of go live. So our team over here will be assisting your team with the go live for about, I think, a period of 7 days. I know I sort of rushed through that. I'm going to get us to now have a quick look at Deb. Is there anything that I mentioned that's causing any questions right now? Or are you guys ready to move on and have a look at what Deb has to show us? Are you sharing your screen?
You haven't sent it over. You haven't made me the presenter.
Oh, I think I did. So if you just pardon me, I'm going to pass this over to Deb, and she'll become the presenter. Yeah. So I think if you just, yeah.
Are you able to see my screen right now?
No, we're not seeing it yet here.
Agreed, I'm also not.
Share.
Yeah. Okay. And then now I'll bring something. Are you hardwired in?
No, it's okay. I'm there now.
Okay. Alrighty.
Yeah, we're seeing it now.
You see it now? Great.
Perfect.
So we're actually showing you what is called Bethesda's board, which is the same standard makeup of what's going to be for the columns and everything across. The only thing that will be different is your locations that's in your locations. So as you're looking at, this is what is called the EDIS, the status board. When you log into the system, this is the information that is there. You'll see the patient's first and last name. You'll see some acute or some alerts that are there. You'll also see what is called icons and menu bar. This is all going to be explained during the training, but as we're going to go through this, show a little bit more. So here we have the EDIS status board. You will also have what is called display board, and your display board will look like this. It'll have all your locations in your department. It'll have the status of the patient, who's still waiting to be seen, how many patients there are there in your department, patient's last name, first initial will appear on the board, any kind of alerts that are standardized for this patient, their age, and you'll see the ages as white and pink, pink for females, white for males, as well as the acuity scores that will be associated with what is being pulled off the triage. What you don't see on this display board view is their chief complaint, why they're there. That's more FIA compliant that way. You can also see who's taking care of the patient, which nurse is providing care, what kind of actions are to be done, what new results are available, and any kind of plan that might be needing. You can also see if there's consults and what status those consults are in. I'm just going to go back to my display or my ED status board. Right now we're going to start off in the triage view. So technically, you cannot start documenting until a patient is registered in the system. So this registration will be taught to make sure that if they don't know the patient's name, to do it as unknown. But if they do have the medical card, basic information, if they have the PIN number, the patient's first and last name, and a birth date, then they can actually do a search and bring that patient into the client registry. It takes this registration less than a minute to get them onto the board. A lot of times, if they are known within your site and everything else, it's 30 seconds. Because you're pulling all that information in. Once you have this patient, you would call them up or be able to call them and say, hey, Noah, can you come to the desk, please? You bring them up to your triage area. If there's a delay from registration to you seeing them at the triage, so this might be a delay in triage, sometimes registration will put in here, headache. Just to give you a heads up of what is there and what the patient has stated to registration. They're not diagnosing, they are just stating what the reason is that they're there for. Next is they would highlight the patient and then they go to the quick launch button, and this is pulling up, oh, I'm sorry, I'm on the physician view, sorry. I have to go back to the nursing view. There we go. Oh, refresh. There's my headache. Physicians do not have the right to triage. Just thought I'd give you that so that it's only a nursing function. If they had the right to triage, then no one would be in your emergency department. Yeah. So here you go. Here's your CTAS triage. This is based on the 2014 CTAS standards, and we've embedded into it infection control, such as travel history for Ebola, if this patient was MRSA positive. So in Dauphin, if you have seen pull up a patient and now you see the yellow sphere, on the triage document it says, hey, they're MRSA positive. That means that they were diagnosed with MRSA from another site and it's been put into the system. Reason for visit, this is the story. You would type in your story about the patient, vital signs. Another nice feature about vital signs is that if you typed in a heart rate of only 8 and you went on to the next one, it would give a little clue and say, hey, you know what, is this correct? Because the heart rate is 8, it's less than 40. Then you can go, oh no, I meant 88. And then you can correct it as well.
So we're just having a little bit of slowness on our end here. You'll just have to bear with us. There we go. Hopefully that doesn't continue to happen.
Other nice features that if you type in a temperature of 39.5 and heart rate of 88, but a respiratory rate of 24, you'll get these little notices that come up as well. So it gives a heads up. Do you think this patient might be sepsis? Should you initiate the sepsis protocol? You would click the OK button. It would remove that off, but then it'll keep you in the back of your mind, is this patient a sepsis protocol or not? We can also record a blood glucose level, numerical value, but if your AccuCheck machine is reading high or low, you can actually indicate high or low here as well. In the height in the weight section, this is for pediatrics, so if they're 1.9 kgs, then you can actually record it in there. It's not in grams, it's only in kg. Okay. CTAS chief complaint. In the chief complaint, there is 17 categories and 168 chief complaints. I'm waiting for the updated guidelines. So my patient has a headache today, so I'm going to choose neurological and headache. The next one is some complaint-specific modifiers, which just describes the headache. So it's chronic, recurring, sudden, severe, worst ever. And once you choose that, it adjusts your scoring on the bottom, and I'm just going to pull down to the bottom. It goes to CTAS 2 because it's a sudden worst ever, and that's based on needs to be seen as soon as possible. But if I chose visual acuity and disturbance stage, it would lower down that acuity score. You also have a falls risk. Have you had a fall in the last year? If you said no, you would know nothing would show up on the board. Some hemodynamic factors, this is all based on your first order modifiers through CTAS. If this patient has a headache, it's a central pain, and it's a 8 out of 10. Sorry, I'm a little bit lagging here for time. You can do a little bit of a GCS here as well. Open. As you go through, this is also, remember this is a CTAS-based acuity. It's just a bit slow. When you hit the refresh button, your chief complaint will show up on the board here. The infection control issue as well, that they may be ILI. Now, next step is that when the patient gets promoted into the back portion of the department, you would double-click in your location and then move them to the new spot. There we go. And I'm just going to move to the new location in the department. You're the nurse in the back. You'll be going through and looking at my patient, and then I'll just go through the board a little bit more. There's other things on this board that also tells you things, information. As their temporary location, if they gone to the X-ray department, you can actually indicate it on the board. Say that you took them to the lab. Diet, you can actually indicate their diet on the board. They're diabetic. Comments, needs a walk test. And if there's any kind of plan, you can double-click and open up the plan column. Working too fast for the computer. Sorry, guys. I have slowed down.
Yeah.
There we go. So that say that they would need a consultant to reassess. Those type of things. Okay. These are all the things that are available on the board. Also on here is your results tab, your patient info tab for information that you want to be able to see, any past medical histories, such as health issues. You can look at their visit history as well to see where they've been and seen at other sites with the same EDT system. You can actually see all those visits here. You can also see all the documents that are written on this patient. Right now it's only the CTAS triage, but let me pull up my back pain patient that I have here, and we can see all the documents that have been written in here. The documents itself are legible. You can actually be able to view them. I'm just going to open this up so look at the document. You can read the full story very efficiently, and you can get a grasp of what's going on with this patient. There's multiple documents for different disciplines. There's the nursing one, has the assessment emergency nursing. The prescriber has the assessment emergency prescriber. There's consult notes, progress notes, as well as a specific note for occupational therapy. They've created their own documentation tool. On the discharge, there's a discharge summary note, which includes a discharge checklist for the nursing, as well as components for clinical findings, as well as pulling in labs, You can pull in vital signs into this. You can also see the for allergies as well. You can see the diagnosis and any kind of disposition. Okay. You can also pull all these documents off the quick launch button. As we go through, we'll show you a little bit more. And also, one note I did forget to tell you about is the procedure note. And that is 32 different procedures, anywhere ranging from IV insertion to NG insertion to urinary catheter insertion to procedural sedation as well as central line insertion. There's 32 different procedures. Okay. That's a quick overview. I don't know if you guys have a whiteboard in your department. So right now, if you bring somebody into the department, you got to take the little blue magic marker, write on the board the patient's name. Here, this way, you can go to any computer terminal, move that patient from triage into that location, and it's most up-to-date information there.
So I think from the nurse perspective, what you'll be seeing is you'll be using the board, you'll be entering into those documents, a lot of the documents that Deb showed. I know in the room we also have a unit clerk, and I'm wondering, Deb, if you could maybe show really quickly some of the printing.
So with printing the documents in itself, the clerk would click, open up the document.
Yeah. Okay.
And then they would hit the specific document, hit the print button. Hit the next document, and hit the print button. So it will be very streamlined for the clerk.
Yeah.
The other thing that would be is that you have to print some reports. So when you want to print reports, and the reports that you'd be wanting to print would be the discharge, patient discharge, is the care assessment flow sheet. That's your assessment flow sheet from during the shift on your reassessment, as well as the vital signs flow sheet. These two things would be printed in the reports. I just wanted to go back to the flow sheets and show you the flow sheets in itself for the nursing component. And the care and assessment flow sheet, the one that we have here, is your ongoing continuous start of shift report, assessment. And then your vital signs flow sheet would be the subsequent reassessments, vital signs, little notes that you would do. As you may notice that there's kind of highlight specific things, morphine, 5 milligrams, oxycodone, consults. You can identify specific things with little notes on the bottom. That would be there.
Thanks, Deb. And then the last folks we have in the room, I think we have Health Information Services. We will be going through some of the impacts to you later at the 11:30 ADT session. So I'm hopeful you'll be able to attend there, because I don't think we'll really have a moment now. We have about 2 minutes left. Are there any questions? How are you guys feeling about this? How does that look to you?
Has anybody there worked with the system anywhere else?
Nights. Like when we're working nights, we have no clerk, we have no aide. Like just the 2 nurses. So
then we training the nurses how to print those documents off.
Nights is going to be difficult for us.
Rebecca? Yes. So we have, Les is an ER nurse and he works night shift. So we have no work clerk. He's just expressing concerns about them on night shift. They have no ward clerk and there's 2 nurses there. So as part of the training.
Yeah, like we have no triage nurse. Well, we don't have a triage nurse right now. But on nights, there are 2 of us. So there's no desk clerk, no aide. We do all that stuff.
Ah, okay. So that would be...
Like the triage here, that's going to be difficult when we're busy with patients. We're transporting people to x-ray, and like I could see this not being done right away when patients come in. We just don't have the staff on nights for sure.
So that's where the registration clerk right in there is headaches, chest pain, so that when you're looking on the system, you're going to go, oh, you know what, there's a chest pain out there. I need to go and do a quick walk the line type of thing, saying, how are you doing? If they're pale, diaphoretic, you would kind of forego the triage. You would get them into the room and start treating them.
Yeah.
You would have to do it according to your workflow.
In our department, it's not that easy on nights here when it's busy. you can be stuck in the treatment room for a while as well. We try to reassess people, but it's difficult here.
Okay. So I think that's something that will likely be talked about in a little more detail in the workflow discussions, and then we'll have some guidelines that your site will develop about when to do what based on what's realistic for you. So we'll just note down your question and make sure that our business analyst includes it when he's doing the review.
Is that specific just to the night shift or, yeah?
Yeah, the night shift. So thank you, Les, for raising that. So you're a jack of all trades, it kind of sounds like. Okay, yes, Heather?
Rebecca, also, so when I finished last week all of the user lists, so should that be reflected somewhere for all the night shift staff when they're doing training so that they're receiving not just what the nurses would typically get, or would there be some, just so there's some overlap on what the unit clerk is doing?
No, they would get that as well. Like the nursing would get how to print things as well. So we will go through that with the training component. I'm just making sure I'm adding that big section into the nursing scripts so that they get taught that.
And as well, we did increase the time for
the conference.
We did increase the time for the nursing classes, Heather, so I think there would be enough time to include this for the evening nurses. I don't see that being an issue.
Okay.
Okay, so Deb will take away on the scripts part. And I'm sorry, I think I heard somebody join the conference.
Yes, I was told that it's actually starting at 11:30, but I see that you guys have started already.
No, we're actually just finishing up the 10:30, but yes, there is an 11:30 ADT. So if you just bear with us, we'll be ready to go for that one in 30 minutes. Are there any other questions on the EDIS side, Heather, in that room?
Any other questions? No, I don't think so right now. No.
Okay. So in terms of next steps for everybody, in the next short while, you will be getting a readiness assessment survey that will ask you some questions about how you're feeling about the upcoming implementation. So if you do have 5 minutes to spare, we would greatly appreciate if you could fill that out. So more communication will be coming out about that shortly. And then, of course, you will have your e-learning. So that will come out on the heels, I would say, in the next few weeks, and then you can take your e-learning to prepare yourself in advance of your classroom training. Also, this session will be posted online, so if you ever do want to see Deb's demo again, you can always access that via a link, and those will be communicated out shortly. Otherwise, then if there's no other question, if you think of other questions, you know who to direct them to. It would be Heather in that room over there, and she has a direct line to our project team, so anything that comes up, we will be able to triage those. And thank you very much for attending.